Hello everyone, Zach Meyer here at Concordia News. I'm coming to you live here as your daily news reporter, and we have a tragic but wonderful story here today for you folks. This is a story of Mary, who suffered a traumatic spinal cord injury after getting into a terrible car accident. But before I introduce you guys to Mary, I have her doctor here to tell us a little bit more about Mary's condition. Hi, Dr. Ford. Thank you for coming today.
Well, hello, Zach. Thank you for having me. I want to thank Mary and Denise both for being here today and letting us do this interview and explaining Mary's story to everyone.
Yeah, so to start off, can you tell me a little bit more about a spinal cord injury, or for short, SCI, and what it kind of entails?
Yeah, so a spinal cord injury is damage to the spinal cord that can result in a loss of mobility or sensation. Most of the time, the spinal cord remains intact, but sometimes it causes damage or loss below the area of injury.
Okay.
So these damages commonly occur during falls, sports injuries, assaults, motor vehicle accidents. Injuries to spinal cords can lead to temporary or permanent loss of function. You can lose your sensory below the injury point. There could be normal sensory motor or the autonomic function. And some patients actually become quadriplegic, tetraplegic, which is paralysis of all four extremities, which is common in spinal cord injuries. In Mary's case, she's a paraplegic.
And what is a paraplegic?
A paraplegic means that only her lower body experiences paralysis, meaning she's not able to move anything below her stomach.
Okay, and so can you explain a little bit, how did this happen, and what are the clinical manifestations of this kind of disorder?
So Mary suffered from a complete spinal cord injury, which comes from the level of T8, is right where her injury was. Mary got into a car accident. She did suffer a complete level injury resulting in, functions of her lower body. She doesn't have any functions of her lower body, but she does have the use of her upper extremities. So this affects the upper torso. She can move her trunk and her body as well, and she has sensation on the upper half of her body, but she lacks the abdominal controls. Mary struggles with balance. She can't feel her legs, her feet. She can't move her feet, that sort of thing. So it's kind of difficult for her to even move in bed and stuff.
Wow, I can't even imagine. That just must be such a huge thing to go through and try to navigate life afterwards. But now, folks, let's hear from Mary herself and her wonderful caregiver, Denise, and see, how much her life has changed since her accident, and hear a little bit about her story. Mary, could you tell me what happened?
Yes. I was driving home late after work, and a drunk driver hit my vehicle, and they were going over, I think they were going over 60 miles per hour, and I ended up flipping my car multiple times. I remember getting hit, and then the next thing I do remember was waking up at the hospital. And this is my caregiver here, who is also a nurse. Her name is Denise, and she takes very good care of me.
Yeah. Hello, my name is Denise, and I've been working with Mary for a little over 3 months now. And she's learned how to adapt to the changes, and she's making a lot of progressions. I do work with her full time because she doesn't have function of her lower extremities, so she does need help with her daily activities that involves any use of her lower extremities.
Yes, Denise do help me with things that I unfortunately I'm not able to do anymore. Since my spinal cord injury, I'm unable to control my bowel and my bladder. And this is something that has been really hard for me to deal with, because it is not an everyday, every day a 37-year-old is having to use briefs. At first, I thought it was embarrassing, But now I just realized that this is a part of me, and this is who I am, and this is how my life will be. And I'm proud of how far I've come after the injuries. And one thing I know is that my injuries do not define me. And Denise here do help me with other things like my the activities of daily living, and I appreciate her.
It's like some of the things that I do help Mary with on her daily things is like I help her shower, I help her change her clothes. We do help with daily transfers and things like that just to get her up out of the bed. But she does also use a wheelchair when we're getting around. We're working on getting her an electric wheelchair just so that it helps her get around and be a little bit more independent, you know. The first few weeks of her being in the hospital for injuries resulted in the loss of a lot of her voluntary motor and sensory functions. The doctor explained to me that they were still assessing her, that her level of function and loss could be determined until her spinal shock resolved, which is something that is common after having a spinal cord injury, which Dr. Ford said it could last anywhere from 4 to 12 weeks.
Yeah, it's nice to see you guys. Great, I'm glad you could join us.
Yeah. So you guys were talking a little bit about edema in the lower leg. So with Mary, in her case, we do put on compression socks to help with the edema in her lower extremities, because sometimes she does have a lot of fluid buildup in her lower extremities. She also takes a medication called Frosamide to help with her edema, and that works wonders for her.
Oh, great. I've heard about autonomic dysreflexia. Is it true that is caused by, complications below the level of the patient's injury site? And does it affect, their bowel impact or their bladder distension, or even does it cause pressure sores?
Yes, I have dyspraxia, and it is basically involves my basic functions of breathing, the blood pressure, and anything to do with my heart rate, which can sometimes become irregular. However, Dr. Ford here, she's put me on a long-term preventive healthcare plan, which has helped me with my bowel and bladder management, which is very important in preventing autonomic dysreflexia.
Yeah, there's also a risk of pulmonary complications, which affects the cervical and the thoracic spine. It can weaken the chest, abdomen muscles, and the diaphragm, resulting in respiratory infections. When we see patients with this, they experience like a common cold, bronchitis, even sleep apnea and respiratory failure.
Okay, so, what happens to those that do experience respiratory failure, and when are they at their worst?
Yeah. Well, I've treated or worked with patients that have had respiratory issues and had to be ventilated, which basically just assists patients with breathing because they're having a difficult time doing this on their own. And so this helps with their respiratory function since they're unable to adequately breathe on their own.
Gotcha. And, what other kinds of complications or systematic complications are there?
Well, there's a few others. There's the bladder dysfunction. It's caused by the L1 and L2 dysfunction, which actually causes problems with the bladder muscle and problems like emptying the bladder, for one. Urinary incontinence can be another. There's also bowel dysfunction. It can cause constipation. And there's also an increased risk for infection.
Yes, because I do have the bladder and bowel dysfunction, and I'm aware that I'm also at risk for pressure injuries and the sores. These are the sores that do occur, and they happen around the bony areas of your body, and they're very painful.
Yeah, some of the areas for skin breakdown are like the sacrum or the buttocks, your outer thighs, your feet, and your ankles. In those areas, you can get wound infections, and they can occur in those areas, which can lead to sepsis, which is also something that's very bad. This is a secondary immunodeficiency, which can cause diminishments in their immune system, which can also place the patient at more risk for a UTI.
Absolutely, yeah, I can't even imagine. What about neuropathy pain? Is that associated with spinal cord injuries?
Glad you asked that. Not only is neuropathy pain a complication, it has the potential to cause paresthesis, hyperalgias, and allodynia. There's also a high sensitivity to stimuli, and it can be caused by the pathways that can be repetitive and causative pain.
So how is it treated then?
So usually we do treatments that can include antidepressants, anti-epileptic drugs. You could do surgery. There's acupuncture. There's transcutaneous neural stimulations, and there's also cognitive behavioral therapy.
Wow, there's lots of different ways. So I guess my question for you, Mary, is what has been your biggest challenge since your accident that you had?
My biggest challenge is the pressure sores because they're very painful, and the fact that I don't move, I'm just bedridden.
Yeah, so some of those things like that are preventative, like are the pressure injuries. So we can do that by keeping that areas that I spoke about earlier clean and dry. And if she's experiencing any kind of incontinence, making sure that I'm keeping Mary dry and clean. We do bathe daily, and then also when she's in bed or just kind of hanging out, we make sure that we rotate her every 2 hours. And then we use pillows also to prop up her bony prominence and keep those from having any kind of pressure injuries, because pressure sores can be very, very painful and very hard to get rid of.
And they can also be painful. Like I do experience a lot of pain. This is because I got the weakness in the lower extremities, which makes me be like constantly using my upper extremities. And since I no longer have any sensation in my legs, yeah. So, and Denise here helped me a lot, and I'm very thankful for her.
Nice. Well, I appreciate you sharing your story. My last question for you is, what kind of advice would you give to those who have also maybe had a spinal cord injury, like such as yourself?
I remember I was so mad when this first happened to me because it was not my fault, and but I have found new ways to help navigate the everyday life, and I've also learned how to adapt. So what I can tell people is that just you're not alone, and don't have this burden, all by yourself. You have to share it. There's so many. Look for a support group out there, and have people and also ask for help.
Absolutely. Well, Mary, Denise, and Dr. Ford here, I appreciate you taking the time to come to Concordia News and share your wonderful story. I'm glad that you're doing a lot better. Seems like you have a great support system here,
Yes, I do.
great doctors, great nurses, and so I appreciate you going into depth with your story, and as well as all the viewers. So yeah, thank you so much for being here. I appreciate it.
Thank you for having us.
This is Zach Meyer with Concordia News. You heard it here first, folks. Have a great night, and thanks for joining our news story.